Merci beaucoup, Sarah.
No, thank you very much, Sarah, and hello, everyone. Now, you gave a perfect introduction to the context of these two surveys. So let's now turn to the Caribbean to tell you about the outcome of two surveys that were conducted last year on mortality and violence in Haiti between 2022 and 2023.
Revenons d'abord au début de l'année 2023.
So let's go back to 2023, beginning of 2023. Haiti, unfortunately, once again was plunged into major political and security crisis since the assassination of the president, Juvenel Moise, in July 2021. And there were
évidemment, vous avez entendu parler des gangs qui
conflicts between the gangs, and the gangs, in fact, have the upper hand on 80% of the capital city, Port-au-Prince. And throughout 2023, there was also an armed group, self-defense groups composed of citizens that decided to try and defend their neighborhoods. Of course, this impacts the lives of the communities, of the population.
Comme vous le voyez sur la carte,
as you can see on this map, Cité Soleil is the neighborhood around the airport in Port-au-Prince, and the gangs hold 80% of the capital city. In fact, the two most powerful ones are the G9 and the GPEP, and they are very active in Cité Soleil. In 2023, they decided to join forces to impose their power on the city. Now, at the start of 2023, the United Nations communicated on the dramatic increase in the number of homicides and kidnappings, abductions in 2021, 2022, and on the massive displacements of population fleeing violence in the capital city. The health system, already quite dysfunctional, was almost paralyzed, and unfortunately there was also a new epidemic of cholera at the end of 2022, and this of course compounded the already existing crisis. As Sarah told you, a crisis prevented a number of NGOs from working properly in Haiti, and particularly for MSF we had to close hospitals. Some of our staff were kidnapped, patients were targeted, and this was more particularly the case in Cité Soleil for OCP, but also for other MSF sections. And we could see that it was a bit difficult to see through the maze of statistics provided by the United Nations. We didn't have any precise figures or statistics for neighborhoods such as Cité Soleil, and we wanted to characterize the level of violence for the population in 2022-2023, but with two retrospective studies to assess the crude and specific mortality rates during the recall period.
Alors effectivement, les conditions sécuritaires.
Now, the security was such that, well, for many months in 2023, we couldn't conduct the survey. And the three sections, OCP, OCA, and OCB,
d'aller enquêter auprès de leur staff national, de leur personnel national.
Decided that maybe what they could do was to talk to their national staff and also to their staff's families.
Un peu plus tard dans l'année,
slightly later,
dans la commune de Cité
in the summer, there was a relative calm in the town of Cité Soleil, so it was then possible to investigate more than 1,300 homes. The two surveys used the same questionnaire.
Qui avaient pu décéder.
And they focus on members who died or were kidnapped, and also the type of violence experienced by household members.
Alors, à Cité Soleil,
Now, in Cité Soleil, we decided to stratify the commune, the municipality, in two zones. The red area, it's the north zone, where the gangs are less active and security is, well, let's say, relatively more guaranteed. And the south zone is in green here on the map, and this is the historical cradle of gangs and the location of the fiercest fights in 2022. In May 2023, we were able to interview 819 MSF members, so it's only slightly over half of the overall staff, and this represented just under 4,000 people, with the members, family members of MSF staff. In August 2023, the survey in Cité Soleil included 1,669 households for a total of 8,202 people. Now, these national staff, of course, is not representative of the population in Cité Soleil. You can see that with the age pyramids. You can see that, well, Cité Soleil population and MSF staff population, MSF staff people are slightly older, they have fewer children, and they are more elderly people. So it's otherwise the sample is still representative of Cité Soleil. Our main objective was the evaluation of crude and specific mortality rates in each population. Now, it's very low for MSF staff. Fortunately, 6 deaths only were reported. On the other hand, the mortality is much higher in Cité Soleil, 176 deaths, accounting for 2.1% of the overall sample surveyed for this investigation. These people are usually men living in the south zone, and we expected this, of course. Now, the characterization of death shows that violence is one of the main causes in both surveys, even for MSF staff members and families. Violent deaths and usually homicides are responsible for the death. In Cité Soleil, homicides, it's in fact exclusively homicides, accounted for 40% of recorded deaths, and even 58% of deaths in the south zone. So it's, well, obviously a main reason for death in our sample. Our spatial sampling allows us to extrapolate our results to the entire Cité Soleil. If we consider the homicide rate as homogeneous everywhere, in the two areas, around 2,300 homicides may have been perpetrated between July 2022 and 2023, which is gives us a terrible number of homicides. And we analyzed our data, and it shows that there is a peak in mortality and therefore homicides in July 2022. And we knew at the time there was a lot of conflicts in the neighborhood. But even if we were to remove July from the statistics, well, the homicide rate is still very high. Spatial analysis on the right-hand side here shows that violent deaths were mainly reported around the port of Port-au-Prince, and particularly the neighborhoods of Brooklyn, Boston. It's not New York, but these are the slums in this area, and also in Belle-Écoute and Cité-Lintou, where 70 to 90% of deaths were homicides. So the homicide rate is just huge in this area.
Était l'autre objectif de notre étude. Les violences subies par les membres des
we also wanted to identify the type of violence experienced by MSF staff, and they experienced mainly threats or witnessed extreme violence.
De l'exposition à la violence.
And we So we selected this criterion of witnessing extreme violence, and this is different from what we did for Cité Soleil people. 12% of people considered themselves direct victims, but fortunately, only 3% of them were directly impacted by extreme physical violence. Violent acts. In Cité Soleil, a total of 5% of people were direct victims of violence, but here
C'était deux choses un peu différentes.
We made a distinction between being a victim of violence or witnessing extreme violence.
Et aussi violence par arme à feu.
It turns out that 13% of the total witnessed extreme violence, mainly by firearms and physical attacks.
C'est quand même aussi un caractère particulier. Il s'avère que 13% du total des personnes.
And we wanted to identify this, and so.
Voilà, de violences physiques vraiment fortes.
They saw extreme cases of violence, and this is really what stands out from the two surveys. The exposure to violence was the other focus of our investigations.
Donc, je vous ai pas parlé des violences. Là, on a aussi caractérisé la violence envers les biens, envers les.
We also characterize violence against properties, homes, burglaries, and so on.
Dans l'enquête auprès du staff.
So for the MSF staff, half of the households were impacted, but it's also a lot of verbal violence. Whereas in Cité Soleil, 44% of households were impacted by at least one type of violence. Spatial analysis of exposure to violence for households, and exposure to at least one type of violence. On the left-hand side, Cité Soleil, where households were exposed to violence in all neighborhoods in the capital city, and it even affects other areas. And this is the case for MSF staff also, and for all sections. And in Cité Soleil, as we saw, violence affected more particularly the south zone around the port, in the slums around the port, but the north area wasn't spared either. It's the whole community of Cité Soleil that is impacted. The survey of MSF families, MSF staff families, was met with mixed success. They have a higher level of education. They live in usually quieter neighborhoods. However, the level of exposure to violence is alarming. No one is spared, and all provinces in the country are affected. Now, this is a survey which is quite unheard of for MSF staff. It's a first. It's a first, but you see, only half of our staff decided to accept or respond to the survey.
Ça va leur servir cette enquête-là.
We had to explain what was the point. Maybe it was not sufficiently explained, and maybe there should be also more communications to the staff about this between the management and the staff. However, the survey was conducted in good conditions with good acceptance in Cité Soleil, and it showed the extent of violence experienced by the population. And we can see that these statistics are slightly above what we collected in 2008.
En fin d'année 2023,
towards the end of 2023, the United Nations published a new batch of statistics and showing that there is a doubling of kidnappings and homicides versus 2022 that had already a big increase versus
On peut
2021.
supposer que les chiffres communiqués par les Nations Unies sont fortement sous-estimés.
And we, considering the outcome of our surveys, we can consider that these United Nations statistics are underestimate the level of violence. So, in conclusion, violence is everywhere in Haiti, especially in Cité Soleil. The official data are no doubt well below reality, and our results stress the importance of NGOs, and particularly MSF, in this country where aid actors seem to be going away, leaving at a time where the population is in dire needs of them. And it illustrates also that with the forced resignation of Prime Minister Ariel Henry by all-powerful gangs, Haiti has become one of the most dangerous countries in the world for civilians.
Alors, je tiens à remercier
I would
Brian
like to
de faire cette présentation en
thank
classe, qui malheureusement a été empêché.
my colleague Justin Léon, who helped us with the survey, the MSF teams in the field, the surveyors the people who conducted the surveys, who did a wonderful job. Thank you for listening.